Good afternoon, Dr. Sharma. Welcome once again to another session on mental health.
Good afternoon, Dr. Vasconcelos. Good to be back with you.
Doc, today is July the 3rd, 2020. And the question I have for you as a medical doctor and a mental health expert, can you address some major ethical principles in medicine?
Yes, the ethical principles that we apply are the four major principles that govern medical conduct. And they're the principles of autonomy, which is self-determination by the patient. We respect the patient's choice to do what's right for themselves. With the guidance of us, we don't necessarily have to dictate to people what they must do. The principle of justice, which is a very interesting principle because sometimes there's a collision between choices that makes it look like there's injustice, but it's really a principle of fairness and equal distribution of care as much as possible. It's not always looking right, but it's done with the best interest of all concerned. And then there's a principle of beneficence, which is doing good for the patient. The duty of healthcare providers is to do utmostly the best that they can for our people who need our care. And then the principle of non-malfeasance, which is not to do any harm, which is also a very interesting principle because sometimes we do harm as we try to do good. A surgeon, for example, would have to cut patient body open or remove body parts to do good. So you could see it's not always a black and white situation going on here. There's some gray or areas that are overlapping, and there's sometimes a collision between those principles. But generally, those four principles that we apply to medicine. But in life, there are many other ethical principles that govern what we call good morality and good conduct by human beings to each other, like compassion, respect, tolerance, patience, all those good virtues.
Outstanding, Doc. Right now, as a medical doctor, I'm sure a lot of people are coming to you in the middle of this pandemic of this COVID-19, and there's a big discussion as to people who are cannot or do not want to stay indoors anymore, and they're going out, and there's a major discussion between people's rights and governments or some government officials, governors and mayors and so, discussing the issue of a mask. People are told to put on a mask. Some people feel it's a violation of their right. Others feel, well, as is the best course of action, kind of like a safety belt, putting on a safety belt. It is a proven fact that it will help during this COVID-19. As a doctor, mental health expert, how would you address this matter?
So that's a good example of a collision of ethical principles where autonomy, the right of self-determination, is collided with the benefits of care for the larger society. So overriding principle is the protection of all. And so we would have to give in to the benefits of the protection of the majority because we are guided by public health laws, and the public health laws are derived from Center of Disease Control, WHO, World Health Organization, Pan American Health, and a number of other international bodies which will be reviewing data and making the best informed decisions. So public health laws are there to protect the public, as it says, and those override individual choices. So we may not feel particularly happy about a rule that affects our privacy, our autonomy, our own lives has got to be put into abeyance. And there's a lot of that has happened over the COVID crisis. By and large, people have tended to be very responsible and cooperative. And it's hard, of course, to fight off our own feelings of independence, especially in a country like the United States, which values self-determination and independence and personal freedoms and the right to carry weapons and so on, carry bear arms, I think you call it, and so on. But it's right for all countries, and it's actually beautiful that we do have that provision in our statutes, and we can apply it to our countries too that are not so highly developed for those morals. Like we see some practices in Guyana that are really troublesome. Now, a country waiting on an election result nearly 4 months. So God knows we're far from getting to those Bill of Rights and applying them, but we're getting there. So the point I'm making, though, Dr. Vasconcelos, is yes, we do have the right to choose, but when it comes to the rights that invade the care or protection of others, then the state also has a right. Doctors have a right. So you can actually take action against individuals who do not follow the rules, the laws. There's a law that is imposed when there's curfew, so there's time limits. So we may not particularly like that, but if we disobey the laws, we will have to pay the consequences. Now, the laws for mask rules are not clear because we're being guided by a sort of understanding that people act in a mature way, in a way that is reasonable, that they would not break those rules and maintain social distances and use of a protective mask, which we know helps tremendously for protection against the COVID virus. And you see, the thing about the COVID virus is because it's so contagious, it's really important that people don't contract the illness or they don't spread it. So a simple maneuver by wearing a mask is very helpful. I think people think about it, while the mask may be very uncomfortable to some, um, it's important that we experience that discomfort, that minor discomfort for the protection of other people. What is the harm? There are some concerns about the mask that I know we have in Guyana where criminality is high and if persons are wearing a mask, they can approach people and even cause them harm under the disguise of a mask. And there are concerns in France. Remember when the rule was made that no mask should be worn or the purdah, so on, that persons of a particular sect should not be wearing those outfits which covered up their faces. Now, those are overriding principles again. How do you handle that situation of security versus the protection of other people? And I think again it's sensible behavior. Some places have actually now put in place laws which say it's mandatory to use a mask. But there's also some expectation that people will behave properly, so they don't have to go to that extent. But when it comes to this concern of security versus self-protection, security of ourselves, that nobody's wearing a mask would attack us, I think it comes down to what I think could work. That once there is fair amount of space between individuals, one, we are asked to be keeping a 6 foot distance. 3 foot is the minimum, but 3 feet, sorry, and 6 feet is sort of what would be very safe. Anything beyond that should be fine, that the person does not necessarily have to wear a mask walking down the road by themselves or sitting in my office here. It doesn't make sense putting on a mask because you're not going to spread it through the computer. So there is some degree of common sense, I think, that people have to apply. And I'm hoping that the authorities would look at this situation carefully because we gotta bear in mind that there is the possibility of people wearing masks in order to hurt people. So whilst we're trying to protect people, we could also be causing some people to take advantage of that situation.
Doc, I think it's fair to say that nowadays common sense is no longer common. And one of the good things you do is try to educate people so much, and it's so important, the importance of education, the importance of ethics in leadership. And so thank you for your words of wisdom. And any final thoughts?
Well, I'm glad that we're talking about these issues of ethics because it's really very important that we bear in mind not only those cardinal rules of the ethical principle, but that we should be guided by good sense. You know, if we can think and if we can rationalize behaviors that are proper, then we will see there's no need for people to get into each other's faces. I mean, to scream in anger, as we saw in a presentation I take in Florida, where people are very angry about having to wear masks or were shouting about their rights. And absolutely correct, but there are situations that say we have to think about the rights of the majority and the protection of our children. And that should override our personal feelings. And unless there's some overriding medical reason why somebody should not wear a mask, I don't see why we cannot put up with that inconvenience for the sake of getting this crisis under control and getting over with it. And then we will be able to go back to a safer way of living because I don't think we should always go back to a situation where we are in each other's faces. And I've said this before now. I think sometimes human beings don't have that consideration for other people. I've seen it. I've been on, say, a cruise ship before, and people don't understand it's a close quarter. They're coughing away, and they're not using any protection. They're not coughing into a towel or to their sleeves and so on. But they're just wildly coughing, not realizing that that virus is going out in the air. This was before the COVID crisis. So we've got a new understanding. We should not let it happen now. We should apply these principles of protection, of consideration for all the time going ahead.
Thank you so much, Doc. May God bless you, and I'll see you again soon.
All right. Thank you, Dr. Vasconcelos. You have a wonderful rest of the day.
Thank you, sir.